Hi, this is Dr. Jeff Cole, one of the fellowship-trained hand surgeons at OrthoSouth. Whether you or your family's problem is pediatric, sports, arthritis, fracture or other trauma, nerve or tendon issues, or overuse, hand surgeons are equipped to treat all hand and upper extremity ailments, ranging from the most simple conditions to catastrophic injuries. We use a team approach with our hand therapists to ensure rapid and optimal recovery. Today I'd like to talk about surgery for carpal tunnel syndrome, and in particular a technique known as single portal endoscopic technique. The components of this system are a handheld trigger mechanism, a cutting blade that elevates with that trigger, and an arthroscope or a camera that connects to a bright light. If you look closely here, you can see me raising the tiny blade back and forth outside the body, and here within the carpal tunnel. The surgeon has fantastic vision on a large screen or monitor, as you can see here, and can release the tight band which causes carpal tunnel syndrome under this magnified view. The goal of carpal tunnel surgery, whether it's done with the traditional larger incision within the palm or a smaller incision at the wrist, is to release this thick band of tissue known as the transverse carpal ligament. This band of tissue is roughly the size of a standard postage stamp, and the goal of surgery is to safely split it from one end to the other. The surgery is usually done in an outpatient surgery center. Most patients can drive within a few days if they are no longer taking pain medications. Many patients will just take 1 or 2 pain pills. With regard to returning to work, each patient's situation is unique. People who do heavy labor or heavy work can usually return to regular activities between 4 and 6 weeks. People who work in an office or who can pace themselves may just miss 1 or 2 days of work, as long as they can leave their post-op bandage in place. The scar is in a location that really doesn't take direct blows with heavy use. It also has a way of fading over time. By 6 to 12 months, the scar is typically barely visible.
It's funny, you can't see either side. I mean, I have to really show people.